Dear friends, hi. I have another interesting case. It's an acute aortic dissection, which is quite extensive, and I would like to discuss it with you. The symptoms, it's a sudden onset central chest pain, radiating to back. The patient admitted clammy, with low blood pressure and acidotic. CT scan was done. It is a male patient, 82-year-old. So let's scroll the images up and down and have a look. Just keep in mind to see all the vessels. Here is the left subclavian artery. Here is the dissection flap. The mediastinum. We will discuss of this a little later. Just have a first look at the images. Pericardium. There is a hiatus hernia here. You can see again the ascending and descending aorta. The flap, the intimal flap, representing the dissection. Let's go down. This is the true lumen, this is the false lumen. We will discuss it about this. This is the celiac artery, the superior mesenteric artery, the renal arteries. Go down. Bifurcation, the aortic bifurcation. Okay, let's go up again. So, first of all, there is extensive high attenuation and fat stranding in the superior mediastinum surrounding the aortic arch. As you see here, there is no active contrast extravasation, no obvious focal arterial blush, but this is definitely blood. Secondly, we can see the dissection itself, which is here. There is a dissection flap originating from the supravalvular aortic root, extended into the aortic arch, and terminating in the proximal segments of both common iliac arteries here. All right. It is very important to check the coronary arteries of the heart. This is the right, and here is the left. Fortunately for this patient, the coronary arteries originate from the true lumen. This is the true lumen, and this is the false lumen. Let's see again. Okay. Let's go up to see the branches of the aortic arch. As you see, the the brachiocephalic artery and the left common carotid artery originate from the true lumen. But the dissection involves the left subclavian artery, as you can see, the intimal flap here. In this case, there is a risk of left upper limb arterial compromise. In this case, we must keep in mind to check the left vertebral artery. it's a little difficult to track it. Probably it's this. Okay. So neurological deficit of the patient should be considered, or impending neurological deficit, if the left vertebral artery is compromised. The pericardial fluid here probably represents hemopericardium. Let's go back to the aortic dissection and let's track the vessel down. First of all, I forgot to tell you, but it is very obvious to see that there is a aneurysmatic appearance of the aortic arch. So let's track the vessel down. There is marked narrowing and irregularity of the true lumen, which is here. This is the true lumen. Here is the true lumen. Significant narrowing. Here is the true lumen, and this is the false lumen. Now we have to check the celiac artery and the superior mesenteric artery. Let's see the sagittal views. The celiac artery originates from the true lumen, which is narrowed. This is the celiac artery. This is the superior mesenteric artery. The contrast is less, if you can see, and it originates from the false lumen. Now let's check the renal arteries, the left and the right. Here is the true lumen, which is narrowed and collapsed, and here is the false lumen. And the renal arteries originating from the false lumen. There is an intimal flap here, if you can see. And in this case there is a high risk of renal arterial supply compromise. And if you see, the renal parenchyma bilaterally shows less opacification and enhancement than expected. Another problem here is that the opacification of the aorta is significantly reduced beyond the bifurcation. If you can see, this is an arterial phase, and there is a reduced opacification of the arteries. So this was a very interesting case of and complicated aortic dissection. Dear friends, thank you for watching. If you find my videos interesting and tutorial and useful, please subscribe to my channel so you will not miss the next interesting case. Thank you. See you the next time.